Hi guys, this is Dr. Sean Leo. I'm an orthopedic surgeon, and today I'm going to be talking about some orthopedic or sports injuries. Today we're going to be talking about some sports injuries. Achilles tendinitis is another very common condition that occurs with running. It usually occurs as you are getting a little bit older, or you forget to do your warm-ups before you run. The basic thing about Achilles tendinitis is that there is a little bit of overuse injury to the Achilles tendon, which is one of the major big tendons in your ankle that powers your tiptoeing or powers your running and sprinting position. After you do a long run, or after you do a run which is more than what you're used to, the tendon, which can go anywhere from the muscle all the way to where it inserts into the bone or where it attaches to the bone, that whole area might actually be painful. It can be sore. Things that help in the recovery are actually resting, icing the area, doing stretches before and after you start on your exercises. And if it doesn't actually get better, then you might want to come and see me for a review. I treat everybody in a special manner. We could possibly help it using some form of injections. IT band syndrome is one of the common conditions that can occur after you run. It usually occurs on the outer side of the knee, especially when you are running. And that usually occurs because of a very tight area around your hip that stretches down all the way to your knee. This very tight band, called the iliotibial band, sometimes rubs against a bony prominence on your knee. And as you are sprinting and if you are running, this particular band and the bone below starts to have a lot of friction and you have pain after your run. A good way of preventing this is to do a proper stretch and a proper warm-up before your run. One of the common injuries that occur is an ACL or anterior cruciate ligament rupture. Anterior cruciate ligament is one of the vital stabilizers of your knee. And if you tear your ACL, your first symptom will probably be intense pain within your knee. You might feel a clunk and there might be a lot of swelling in your knee. If this is the case, you should actually stop playing, ice your knee, come for a review as soon as you can. Picking up an anterior cruciate ligament injury early is very important because it not only prevents you from re-injuring your knee, you might not have a proper stabilizer of your knee after it's ruptured. It will also allow you to be able to select an option of treatment early. Selecting an option of treatment can involve either surgical or non-surgical approaches. If you think you do have a knee injury, stop the activity that caused the knee injury. Come over for an assessment to make sure that we know what is going on. If there is a serious injury, you need to treat the injury so that you can get back to your activities as soon as possible.